Good afternoon, everyone, and welcome to today's SADA webinar. We are delighted to have you with us for another informative session to help the public better understand oral health and the dental profession. Today's session is especially exciting as it's aimed at all the budding dentists out there. That is anyone that is curious about pursuing a career in dentistry, and who better to guide us through this journey than Dr. Aiden Schlome, a newly qualified dentist currently completing his community. Dr. Schlome, we're thrilled to have you with us this afternoon, and thank you so much for joining us. Over to you.
Thank you so much. I really appreciate it. So today I'm really excited to share with everyone about studying dentistry in South Africa. We're going to delve into the different universities that offer dentistry in South Africa, and I'm really excited about that. So basically, the journey of dentistry is really more than just about teeth. So dentistry is about smiles, it's about confidence, it's about health. And I want you to think of the mouth as the front door to the whole body. So basically what happens here affects everything else. So what we've seen is that gum disease has even been linked to heart disease, it's been linked to diabetes, it's been linked to pregnancy complications. So when you choose dentistry, you're really not just fixing teeth, you're protecting lives, which is really amazing. Mix of science, of art, and compassion. And you get to use your brain, your hands, and your heart, and you'll relieve pain, restore confidence, and even prevent disease. And here's the very exciting part, is right from the beginning of the training, you'll be working with real patients. So you're not only going to be working on mannequins, not only just stuck in your textbooks, you'll actually be treating patients who need your help. And after 5 years of study, you'll spend a mandatory year in community service, giving back to South Africa while also sharpening your skills at the same time. And it's really a journey that blends learning and you are having an impact on the people in your community and in your country as a whole. So I'm going to take you a bit through the path of studying dentistry in South Africa and just basically an outline of studying dentistry in South Africa is basically you will study for 5 years and then you will do your 1 year of community service. And then after that, you will have your lifetime ahead of you, changing lives one smile at a time. And it's really not just a career, it's actually a calling. Okay, so now I'm going to talk about how you get into study dentistry. Okay, I'm just going to share my screen that you can see all about the different universities and the links to their websites. Right. So this, I'm just quickly getting recording. I mean the slide. Okay, so I'm sure you can see the slide on the screen now.
Yes, we can.
Okay,
Thank you.
so great. So basically, South Africa has four universities offering dentistry. So at the University of Pretoria, you will study what's known as the Bachelor of Dental Surgery, BCHD. It's highly competitive with strong academics required. At the University of the Witwatersrand, you will study the BDS or the Bachelor of Dental Science. They also look at your marks and they sometimes have interviews, and it's a very vibrant and diverse environment. At the University of the Western Cape, you will also study the BCHD. UWC is known for its community focus and inclusivity. And at Safaku Makatu Health Sciences University, also known as SMU, you will study the BDS. And SMU emphasizes transformation and draws students from across South Africa and beyond. And across all of the four dental schools in South Africa, the golden trio of matric subjects is always required. So you need mathematics, physical science, and life science, and strong marks in grade 11 and 12 in these subjects are essential. From another angle, if you would like to pursue dentistry after pursuing another degree, the universities will obviously look at your previous degree's results, and that's how they would basically select you for the degree. Okay, so admission is also competitive, but if you've got the passion and perseverance, you're already halfway there. Also, something to be aware of is a minimum of 16 hours of observation and job shadowing is required for the University of Witwatersrand, and you'll have to submit a job shadowing certificate when you submit your application. At the University of Pretoria, a value-added questionnaire will be required, and this looks at your involvement in extracurricular activities as well as leadership skills during your high school career, which can also be used as part of the selection process. And another important thing to note is that often the dental schools will require you to complete the National Benchmark Test or the NBT as part of the admission criteria. And whichever school you choose, you'll be joining a proud tradition of excellence. Also, what's important to note is that the closing dates for the applications vary between the different dental schools in South Africa, and you'll just have to look up on their websites as listed on my slide. But it usually will close between around June and August each year. So now I'm just going to talk about how the course itself is structured. Okay, and obviously it depends on the institution, but basically, as I've said, it is a 5-year degree. So in years 1 to 2, it will be the preclinical foundations. So you will dive into the basic sciences. So you will do your anatomy, your physiology, biochemistry, pathology, which are really all the building blocks of medicine. And alongside this, you will also start delving into dentistry. You will do some oral biology and dental materials and learn about the teeth and the gums and how to work with them and what can go wrong in order to prepare you for your clinical years up ahead. So before you even touch a real patient, you will work on models and mannequins just to prepare you. And then in your third and fourth year, this is where your clinical training begins. So you will now move and transition towards real patients. Okay, you will, under supervision, be treating these patients, diagnosing dental diseases and oral conditions, and you will rotate through the different specialities within dentistry. So, for example, you will go through oral surgery, you will go through prosthodontics, which has to do with prosthetics and dentures. You will go through orthodontics, pediatric dentistry, periodontics, and oral medicine, which has to do with the gums and the tissues of the mouth and oral diseases, and many more. And you'll also get exposure to hospital-based dentistry, and you'll work alongside medical teams to understand the oral systemic connection. And then in your final year of study, this is where you basically will bring everything together, and this is your advanced clinical year. And basically, now you are more confident and competent, and you can handle more complex cases. You basically refining your skills and preparing yourself for independent practice. Also, you will engage in community outreach programs. You'll also treat patients in rural clinics and underserved areas, which is a very powerful reminder of why dentistry matters. Okay, so also remember that throughout your years of study, each dental school has a dental house committee, which are made up of senior students to help support you and make your journey through dental school seamless. In addition, there are organizations such as the South African Dental Association, known as SADA, and we are there to assist you and guide you all the way through, right from the beginning of dental school up until the end of your career. And then after graduation, you will, as I've spoken about, complete your community service year. This is mandatory in South Africa, and you will spend a year serving public communities, in public hospitals, in very rural areas. And it's both a very good way to give back to South Africa as well as to refine your skills and to make you prepared for private practice or further specialization. So, just to say that there are very fun parts about dental school. What's very exciting and motivating is the fact that you work on real patients. You will also do community outreach projects, serve rural areas and schools, and you'll also train in cutting edge labs and other facilities, which is very exciting. You're also going to collaborate with multiple other medical professionals, such as doctors, nurses, because dentistry is part of the bigger healthcare team. And also, if you're curious or you want to further your studies, you can always dive into research opportunities, ranging from oral cancer studies to biomaterial innovations. And it's very hands-on, it's very impactful, and it's a very exciting career. So after you've completed your community service, the world is your oyster. You can go into private practice, you can go into public health, you can go into research, or even opportunities abroad. And dentistry really opens up doors everywhere. So basically, just to summarize, in South Africa, dentistry is a 5-year degree, and it's really not just a degree. It's a journey of science, service, and smiles. And after that intense 5 years of studies, 1 year of giving back, and a lifetime of changing lives, you really will feel so fulfilled and so knowledgeable about your career. And yeah, just thank you so much for this opportunity, and I hope that this will help you guide, will be a good guide to help you when you decide to study dentistry.
Thank you so much, Dr. Aiden. I'm sure that that will actually guide a few of our budding dentists out there. Hopefully, it's more than a few. Hopefully, we actually get a whole class full that will hopefully see this message. Perhaps we could chat just a bit more about, once you qualify as a dentist and say you'd like to pursue specialization, what are the opportunities that you could look into?
Okay, so you could look into all the different fields within dentistry. So as I spoke about, there's maxillofacial and oral surgery, there's prosthodontics, there is orthodontics, there is oral pathology, there is what else am I missing? Periodontics and oral medicine, public health or yeah, public oral health, which forms part of community dentistry. So there really are multiple different fields. Obviously, at an undergrad level, you do the basics in all these different fields to create yourself as a general dentist. But if you do plan to specialize, you will delve into a specific field in dentistry. Obviously, when you do want to further your career and specialize, you will have to do some postgraduate studies, such as postgraduate diplomas or master's degrees before getting into the specialities in South Africa. Also, some of the specialities require you to write primaries in your primary subjects, such as anatomy and physiology, through the College of Medicine in South Africa. So it really is quite a big step to take when you do want to specialize, but it also can be very rewarding.
Yeah, absolutely. And in your opinion, what do you think is the good personality traits to have as a dentist? Or, what do you think when somebody who is thinking of pursuing dentistry and they find that they're very short-tempered or impatient or something, instant gratification, what do you think are good personality traits to have for someone who wants to perhaps pursue the career?
So I definitely think compassion and patience because it does take time to develop the skills you need in your hands to be able to carry out the procedures in dentistry, which dental school will definitely teach you. And you also definitely need that compassion in order to treat your patients with respect and to put them first before yourself. And you must remember that even though you are doing this because it is a career, you must place the patient first, and it's more than just about the money. It's about the patient care and what's best for your patients.
Yeah, 100%. Couldn't agree more. Thank you so much, Dr. Aiden. Yeah, I really hope that someone out there finds, even if it's just one person, finds this valuable and hopefully is successful in pursuing a career in dentistry or any facet of oral health. But thank you so much for availing yourself today, and we really appreciate your time and your expertise.
Thank you so much for having me. I really appreciate it.